Welcome to Life Vibes. I'm your host, Breezy Clark. And today I am at the Heflin Family Clinic interviewing Dr. Linda Heflin about integrative medicine and nutrition. Welcome to the show, Dr. Linda Heflin.
Thank you, Breezy. Thank you for having me.
I appreciate that. And Dr. Linda Heflin has been in the practice for over 20 years now. And what we're talking about today is integrative medicine and integrative nutrition, which is a little bit newer concept for people. And so, Dr. Linda, tell us a little bit about the two.
About the two, okay.
Just a little basic. I know that there's a lot to it, but just a little bit of a background of
what that is.
Of what that is,
Okay.
yeah.
Well, I think to start off with telling you what it is, I need to start off with where I was before I got to this.
Well, right, because in 20 years in practice,
Yeah.
you say you've been traditionally trained. This is a family practice. And so you came into the study of integrative medicine and nutrition.
Just in the last 2 years.
Just in the last 2 years. So this is just
This is
newly-
new.
Okay, and so
integrative nutrition just in the last 4 months.
oh wow,
Very new.
Okay, well that's exciting.
And still doing that.
So that's something that you've come into in your practice that you found is a really vital part of health and nutrition. So so before you got into the integrative medicine,
What did I do?
what did you do? Yeah, you're
I-
having the family practice. You've been doing this 20 years. You've obviously are well established as a physician. And so what
Well-
is the history there?
Well, the history is traditional allopathic physicians learn about disease and treatments for diseases. And there's really not much of an emphasis at all on nutrition. And there's really not a lot of talk about healing of a patient. And so for 20 years of seeing people of all ages, we actually still deliver babies, so seeing patients from birth to death and following along with what happens to people as they age, I started seeing a lot more chronic ills. I mean, most people are familiar with hypertension and cholesterol problems and diabetes, but it seemed like in the last 2 to 3 years, the numbers of people that I saw with these diseases was increasing. And I was struck by the fact that almost every person that I saw and got lab work on had a chronic illness, and they started showing up at a lot younger ages. 30 and 40-year-olds with hypertension, even some 20-year-olds with hypertension.
Wow, that's hard to imagine.
Yeah, kids with diabetes, type 2 diabetes. That's unheard of. This is adult onset type 2 diabetes.
Right.
And so I started looking to kind of find out what was going on, and sort of went and looked up some statistics and found out that 50% of American people today are overweight.
50% of the American people are overweight.
30% of that group is considered obese. So I mean, if you even take a subpopulation out, you're dealing with overweightness and then obesity. And overweightness and obesity leads you towards chronic health problems.
Then you go into having more problems. It's not just about needing to lose a few pounds. It's about your health risks.
Exactly.
Wow, and that the large numbers, I'm sure as a physician and as many years as you've been in this practice, that was an alarming number.
It was a large number, and I started kind of looking to see why. Why is this changing so much? And that got me into discovering, what's happened in the last 50 years pretty much in our country as far as diet changes, food additives, stress, and how all those things work together to actually go against the healing process of the body.
Right.
So when I started looking into this, I stumbled upon another physician actually, and her name is Dr. Lissa Rankin, and she just wrote a book called Mind Over Body, and it's about the healing process. And when I found her, she was leading the same pathway. She was disgruntled with what was going on with traditional medicine, and she felt like she was doing a disservice to people by just continuing the pathway of passing out pills. And so she actually started an integrative medicine fellowship, which I looked at doing, but I can't take the time off to do.
Right.
So I've purchased books, and I'm doing a lot of things online to learn how to do this, and gone to conferences to learn more about integrative medicine, because I really feel like the difference is Western medicine just looks at the ills. It looks at what's wrong with the person. Yes, we do prevention, and I really am big on prevention because I think that's key to keeping people healthy. But it looks at more once you've got something, then what do we do for you? And it's not so much what do we need to do with you, what do you need to do for yourself? It's
Right.
here's a pill.
Right.
Here's this.
And people, I think, have become really dependent on that.
Yes.
Just knowing that you can go to the doctor, you can get your prescription,
Right.
and you give it an X amount of time and you'll be better.
Right.
And so, but like you said, in the last 50 years, if you look at the American diet, that it's gone to more fast food and artificial foods, and that there is a movement now that I've noticed where you're seeing more health documentaries that highlighting these habits, and books that are written, and people that are coming out and saying that it's really all about the foods that you're eating, the lifestyle that
Right.
you're living, that most of these illnesses are preventable.
Right.
And that we
Right.
don't have to live this way.
No, we don't.
But that in the Western society, we're so conditioned thinking that go to the doctor, get your prescription,
Right.
and then just keep eating the way that you want and living the way that you want. And that's not to say that you should live inside any certain ideals,
Right.
but just to be aware and to be
Right.
knowledgeable about how to prevent that.
That's true.
These illnesses that are just taking over, and that the growing numbers that you're seeing, just as a physician, and 50% of the American population being overweight, 30% being obese.
Yeah.
I mean, that obviously something is
Not
is
right.
triggering all of that.
True.
That's causing that problem. And so that you have gone through these great lengths to study and to learn. You're obviously very passionate and believe
I do.
in the power of all of this.
Of healing.
Of healing. It's the power of healing.
It is.
And that you are a physician that not only practices the cures of the current ailments, but that you're looking at the preventative
Right.
measures, because you want to see people living healthier.
Right.
Not just treating patient after patient for the same illnesses or growing illnesses.
Right.
Because it seems like it could be a domino effect.
It can be.
That you have one, and so that leads to others.
It does. It does.
And now we're just, in our society, it seems as if we're just used to it.
Mhm.
It's just a part of life.
I think if I can show you an example to kind of let you know, because I don't want people to think that integrative medicine means you throw out traditional medicine. That's not it at all. And it's not doing alternative medicine either. It's taking things that are complementary to traditional medicine that have gone through the same pathways that traditional medicine goes through. In other words, they're proving this by evidence that these things are not harmful to people. You know, that if we do yoga, which is something that I've started to do, and I mean, and for relaxation, that we know that that can lower blood pressure. We know that that
Right.
promotes healing for people with cancer. If you look at acupuncture, if you look at nutritional supplements, there's a lot of things that people can do that are complementary to what we do. So it's not throwing out traditional medicine.
It's
so I
just
don't want
finding that
people.
balance.
It's finding the balance, and it's what we're learning in integrative nutrition is the primary foods and the secondary foods. And the primary foods are your relationships with yourself and with others. It's your work environment. It's your spirituality. It's your exercise, and it's your nutrition. And so those are the 5 pillars that we have, and if any of those things are out of balance, then that's where the health issues come in.
Oh, I see. And that can be hard to maintain that balance because of
Yes.
lifestyle.
Yes.
When you're maybe, in a hurry, on the go all the time, you can't make the healthier
Healthy.
eating choices, or you are in an unhealthy relationship, or your work
Exactly.
environment is stressful. So all of these things come into play.
Yes, yes.
So there's not just one solid answer. That's not one size fits all. But it's just the idea of taking the approach from another angle.
Right.
And looking at it through a fresher perspective, and realizing that there's so much healing just within ourselves and within the foods that we eat,
Exactly.
that we have those options.
And learning how to be, I think the integrative nutrition approach is learning how to be a health coach, which is what I'm in the process
Okay,
of
so
learning.
integrative medicine and now integrative
Nutrition.
Okay, so I mean, there's so much to
There's
it.
a lot to
Oh,
it.
there's so much to it. It's great though.
And
It's
you
also
can,
good.
and they're all intertwined. But being a health coach, which is what I'm learning how to do now, is different than being a physician. It's a different hat, and it's actually putting the patient in the driver's seat as opposed to the physician
Well, because
or
I
to
think-
the health coach.
Well, you would want people to be independent and
Right.
to learn.
Right.
And so that would be a different hat to be wearing.
It is.
So now you're kind of practicing. You said 4 months now that you've been
4 months that I've been doing the integrative nutrition fellowship, which is a year-long process.
Uh-huh.
So
Well,
One third of the way through.
1/3 of the way through. Well, that's great. There's always a journey.
Yeah.
And that's great. After 20 years in the practice, you decided that this
is what I want to do.
This is what you want to do, and that you're seeing so many healing benefits. So now that you've been into the integrative medicine, you're doing great with the integrative nutrition, applying that to your practice here, have you found it difficult to integrate, or has it been a smooth process to transition into?
It's depending upon the patient, because some patients have things that are more amenable to me adding things to, and some people are more willing to listen, and they want to hear and they want to know. So
Once again, finding that balance.
Yeah, it is. And I mean,
Everyone's
not
different.
everybody wants to. Some people want the old, and they don't realize that they're getting in the way of themselves.
Getting in your own way, absolutely,
Yeah.
absolutely. But you have had some patients that are
Very interested, yeah.
Well, that's great.
Yeah.
But in another way that you've been able to reach people outside of your practice is you have a Facebook page called Live Well to Be Well.
Yes.
And you're able to post recipes and ideas and just putting it out there just so people can see what's available.
True. And I'm going to have a Live Well to Be Well actually webpage, which is in the process of being done, because the health coaching aspect of what I'm going to do is going to be separate from the physician part of what I'm going to do. And so that information as it unfolds, and I think I have to be at least 6 months into the program before I can introduce any more of that out there. So I have a couple months more to go. That's going to be on the Live Well to Be Well website.
Oh, okay.
But the Live Well to Be Well Facebook site, right now, it's pretty much, it's more vegetarian, vegan, or raw type food. It's more kind of positive, inspiring kind of thoughts and ideas to keep people going. There's not a lot yet as far as, integrative medicine approach to it. There's not a lot else put in there
But
as
it's
far as
building.
topics, but it's starting out.
You got to start somewhere.
It's starting, yeah.
Well, and I think that when people see things like that, and then knowing that it's from someone credible and knowledgeable,
Right.
that they know that there must be something to it, and so that they could be more apt to trying something or listening. Because a lot of times I think we get closed off because we just think we know and we don't want to try anything new.
True.
But to see your ideas and to know that as a physician, you're practicing the whole foods diet
Right.
and trying new things and saying that not only how it's enjoyable, but the health benefits
True.
and the healing benefits of some foods that people aren't aware of.
True.
And just to give that education and that information out to whoever may see it.
Right, right.
And like I said, obviously you have a passion for for integrative medicine and nutrition, and to continue on as a physician and to try and intertwine it all. You're very busy.
Yes, but it's very enjoyable, and it's been really good because I feel so much better since I've taken upon this lifestyle myself. And I feel like if I'm going to help someone else, I have to practice what I preach.
Oh, absolutely.
I can't tell someone else to do something that I wouldn't do for myself. And
Right.
plus, it gives me a chance to get an idea of what things might work for somebody and what things might not, and I can tell them that from my perspective. So they've got an idea of, if I've done acupuncture, or if I've done yoga, or if I've done meditation,
know how you feel.
I know how that made me feel, and I can share that with somebody and also give them places to go to get that done themselves.
Right. And
So-
to know, like, when you, if you've enjoyed something yourself or how it's made you feel, and to just be able to share your own testimony, because I really think that personable feeling of connecting with someone else, knowing that you've done it, that you've made that change, and these are the benefits that you've experienced, and this is how it's changed your life.
Right.
So let me ask you this: so you've been able to add this into your own practice. Are there many physicians that to your knowledge,
Are doing
practicing the
this?
same, similar? Once again, not one size fits all, but similarly, are they trying to add in?
I think there is a movement going on in America. I think a lot of physicians are waking up to the fact that what we are doing isn't working, and we need to make a change. As far as the actual number of people, there aren't a lot of people that have done the integrative medicine fellowship, and it's a small amount, but it's growing. I
But
think
it's a start.
It's a start, yeah.
But this is something that hopefully we're going to be seeing more of in the future.
It needs to be recognized by the insurance companies, and that's a whole other story. Insurance companies don't recognize it to be necessarily a value. So some of the things that can be offered through a nutrition counseling, health coach type seminar versus coming in for an office visit, it's not something that they recognize as something that's reimbursable.
Right.
So at this point, it puts a lot of pressure back on patients as far as what patients
Right.
can
And
afford
they
to
have
do.
and sometimes you just have to compromise.
Yes.
And you just, but hopefully in the future, as this grows, that
Prevention
will
is
change.
going to be important,
and it will, and I think it will.
healthy
and,
lifestyles.
and I think eventually that will change with the medical and insurance as well. Once we find the balance with all
Right,
of it.
right.
Well, and as more doctors and physicians become aware and involved with the integrative medicine and nutrition like you have, I think that's going to make the biggest
I
difference.
think so too.
Well, I have really enjoyed talking to you, Dr. Heflin.
Thank you.
And we really appreciate that you've been on the show today.
Thank you.
And I look forward to seeing what you do in the future.
Sounds good.
And good luck with your fellowship.
Thank you.
I'm sure you'll do great.
Thank you. Thank you very much.
And
Thanks.
Life Vibes has been a product of Texan News Service. Be sure to follow us on Facebook and Twitter. And until next time, keep the good vibes rolling.